Thank you for being a part of this conversation in our series regarding young onset Parkinson's disease. Today, we're going to be talking about navigating young onset Parkinson's as a woman with Kristi LaMonica. We often hear about PD, from the older perspective, white man's disease, and honestly, the reality for women is significantly different. Especially those who are young, and a lot of issues being a younger woman often aren't even addressed. So we recognize little attention is given to this. Few studies have been done on the experience of having Parkinson's as a younger woman, especially those in childbearing years. And so that is what we're going to be focusing on today. So for those of you who may not know Kristi, she is an associate professor and chair of the Department in Biology and Health Sciences at Russell Sage College in Troy, New York. She studies young onset Parkinson's disease and its specific impacts on women. And she was also diagnosed with young onset in 2020. So Kristi, thanks for joining us.
Thank you for having me.
Absolutely. And I'm going to spotlight you so everybody can see you. Okay. So first, let's just hear a little bit from you about your journey with Parkinson's. What age were you diagnosed? I know that was 2020, so it was only 3 years ago. And what challenges might you have faced being diagnosed or getting the diagnosis?
Sure, thank you. I just want to first admit that being a woman and having Parkinson's at any hormonal stage in life is difficult and not really well studied at all. So menopause, perimenopause, it's all not fun. Yeah, I was diagnosed in 2020, but I've had symptoms back to 2013 from when I was doing my postdoc endeavor. So all my shoes on the left insides, that on the little toes that are worn out from me clenching my feet from dystonia. So I've really had it back to 2013. I was expressing my motor symptoms. I ignored symptoms for a number of years. So I think when I was going through part of my 10-year process early on, my 3rd-year review, I started clenching my hands a lot. And I walk out to my car and wonder why my hand's in a claw. And I would do that all the time. And then my fingers started going crazy when I would type in meetings in front of people on the big screen. Of course, always typing out swears because that's how it always works when you're with colleagues. And I just noticed a lot of other weird symptoms that my hips started hurting, my elbows started hurting all on my left side. And so I ended up having hip surgery, and it took me a long time to heal from that. I remember the surgeon saying to me, "You need to relax your hip because I can't articulate it." I'm like, I can't relax anymore, dude. It's like, this is as relaxed as it gets. And he was getting mad at me. We didn't know it was my Parkinson's. I was just so tight that I just couldn't relax because my Parkinson's. And I thought that I was. No one ever watched me walk during that time. If they had watched me walk, they would have noticed that my gait was off. But everyone's like, "Oh, no, you're fine, you're fine." And then fast forward to finally getting my elbow taken care of a few years later. The ortho, after sending me for an EMG that ended up being negative, an MRI and other things, he's like, "Oh, I think that you have Parkinson's. Good luck." I'm like, "Okay, thanks, buddy." So that was a not very gentle way of diagnosing someone. I mean, I kind of already knew that something was up, and I kind of knew what it was, having a background in neuroscience too. But it's really hard when you hear from someone who's more official. Me saying it myself is not a big deal, but someone official saying it kind of is. So it took me a long time to get into the movement specialist. And then they diagnosed me pretty much as soon as I walked in.
And then once you saw the movement disorder specialist, did you feel that the approach to, the care was different when you met with them? Did you get any additional information? Were they compassionate, empathetic? What kind of experience?
They were great. I can't say enough great things about my movement specialist. He's absolutely fantastic. I'm really lucky that I ended up seeing my doctor that I'm seeing, because I started off seeing a different fellow, and I ended up with my movement specialist. He took over the fellow's cases. And I'm just really lucky. He's absolutely fantastic, really responsive, and we talk a lot.
So I sort of jumped into this program and I did put it in the chat, but I just want to verbally state that this is intended to be an interactive discussion, not just between Kristi and me, but I want to hear from everyone here. If you have any comments or questions as we go along, we're going to intersperse those into this discussion. We want it to be everyone's discussion. So I just want to make sure that that is stated. Kristi, being a woman with Parkinson's, you kind of understand some of the gender disparities that exist in healthcare. Can you talk a bit about some of those challenges that women in general face and how this is more challenging in Parkinson's or young onset Parkinson's?
I think first of all, being young and having Parkinson's it's very difficult. So I recall going for like a mammogram and the nurse telling me, "Oh, you're too young to have Parkinson's." I'm sorry, my brain didn't get the memo. You know, it's like it does happen. So and other healthcare professionals tell me that, "Oh, you can't have Parkinson's." Yeah, I do. And being a woman, I think it takes a little bit longer to get diagnosed. So being young onset is a very circuitous diagnosis, but being a woman, I think it's a little extra few loops around to get diagnosed. I think there's just more complicated.
Right. And, you know, honestly, it is challenging, I think, sometimes. Well, let me rephrase it. Do you feel like women, if it were a young male seeing a health practitioner, that it would have been brushed off as much? Do you think that there's any difference in that perspective?
A little bit. I think that most people think that more men are affected than women, but it's really 40% women to 60% men, which isn't really a broad difference. So I think that they think that more men are affected, so they're looking out for men more with Parkinson's. So I think that they'd have an easier time, but I still think as a young onset, it's still really difficult. Because most people get diagnosed with some orthopedic issue first.
I was thinking about, and I think that this was shared a few years ago from the Michael J. Fox. I don't know if it was a blog or something that I read, but there was a story about a young woman who was in the hospital. She was having a child, and after she delivered, she hadn't been diagnosed yet, but she was having significant issues after the delivery, and she rapidly progressed in her disease symptoms without realizing she had Parkinson's to begin with. And they chalked it up to postpartum depression and said then she was drug seeking when she kept going in to be seen. This never was able to pinpoint what was wrong until quite a while later. But by that point, she hadn't been treated for so long and was having some sort of I wouldn't call it postpartum initiated crisis, but obviously she was going downhill rapidly until she finally was able to get on the treatments. But in that meantime, she lost her job, and it caused a lot of financial strain on her family because she wasn't able to work. And so it was a whole issue of, being young and of childbearing years. Who knows what, and we're going to talk a little bit about childbearing and menstruation and all that on the disease, but just that experience, how unfortunate it is that somebody goes through something like that. Have you heard of any other stories like that?
I haven't heard of anything that severe, but it makes sense. It's a lot of people aren't looking for a neurodegenerative disorder like the first thing, so it makes sense that it would take quite a few years and a long time to get diagnosed, depending on what your symptoms are too, because it might not be what they're looking for. So if you don't have all the common symptoms, motor symptoms, they might not be looking for that.
So in the comments, I have to scroll up here, but we got a comment. I would like someone to talk about how young women are susceptible to dyskinesia. Why aren't we told that we can told that so we can make informed decisions? So
Because
drug sensitivity. So
there's
maybe,
not many, there's not many like there's not many publications on that. There was one that came out pretty recently with naive drug patients that they tested women versus men for young onset, and they found that women were actually more sensitive to carbidopa levodopa, so they need less, but they need more frequently. So that's an issue, and since women were actually only included in research in the US in 1993. So most studies actually in clinical trials don't include women. So we don't really know much about the pharmacokinetics of many drugs. So we don't know about the sensitivity of them. So it's kind of a big black box, except for this newer study that shows that women are definitely more sensitive, that we react quicker, but it lasts shorter. So
yeah, and we had a comment that Becca wrote in, I think not having a tremor delayed my diagnosis. So delay in diagnosis, maybe not being the same responsiveness to medications, big issues.
Same, Becca. I don't have a tremor either, so it was really, if I'm slow as if I'm not medicated, I'm ridiculously slow.
Well, and that was one of the things that we wanted to really kind of dive into is, the fact that it is often taken for granted that women are going to respond to medications or treatments the same as men. And we'd like to know a little bit more about how gender does affect the pharmacokinetics.
It would make sense that we'd be more responsive to certain drugs because, or actually maybe not. It's based on how a lot of drugs, metabolism is based on how we carry fat, and we carry fat different than men. So we can't expect them to work exactly the same in females as they would in males. So giving everyone the same dose is just not, it doesn't work. So definitely splitting up carbidopa levodopa, taking it more frequently, taking smaller amounts does make more sense to kind of try to customize it. But yeah, nobody tends to tell you that you're going to end up with major dyskinesias.
So how does menstruation impact medication effectiveness? What have we learned about that?
So there's really not much known about this until a bunch of surveys came out. So the first one was Rochelle Flanagan's through the PD Avengers. She started asking women about their experiences with menstruation. And then the PD Avengers, we came out with a survey that was implemented through the Fox Insight about menstruation. And we found that this actually finally put numbers to what we knew anecdotally, that women are affected by menstruation. So about 2 days before to a couple days during, their medication doesn't work, or it's not effective, or their PD symptoms are exacerbated during menstruation. We're not really sure what it is. It seems like it would be medication effectiveness, kind of, maybe, possibly. So we finally put numbers to that. And so hopefully we can get somewhere with looking into it more, because it's really not published in many places, published anywhere. And not even all movement specialists don't even understand that hormones do affect your PD symptoms, which is just really disappointing.
Yeah, and I would love for people in their comfort level to share maybe some of the experiences they might have during that. Because I had another person ask Becca how everyone is dealing with the medication during their menstrual cycle. And then, how about even considering childbirth, like having children? What do women do if they want to become pregnant?
Sorry, I missed half of that, sorry.
What do we do about the situation if women are wanting to become pregnant?
Well, we're not sure if we don't think that Parkinson's affects fertility, so that's probably not an issue. People should still plan on using birth control if they don't want to get pregnant or not use birth control if they do. We don't know anything about that. We don't think there's any link to infertility, but we don't know about medication safety. So carbidopa levodopa seems to be the most prescribed during pregnancy. Immunity is definitely not safe, but it's not known if the a lot of agonists are safe or not, because all the testing for agonists for animal testing on pregnant animals was done at like 10,000 times the physiological dose, which gives us no information at all about if it's teratogen, if it's going to cause mutations, or if it's going to cause birth defects.
Okay. And that is important. And so I'm going to allow people to unmute. And I know there's some questions I was kind of going to go back to that you just dropped in the chat, but I want to give people an opportunity, if you're okay with that, Kristi, to unmute and just ask questions.
Yeah.
We're a small enough group that I think it would be easy to do that. So I think Sabella wanted to ask or make a comment.
Yeah, I'm friends with like
I was
Hi,
just going to ask, hey, thank you so much, Kristi. Nice hair. I was just asking Kelly if you were allowed to us to mute ourselves, because I mean, there are all these amazing questions that people are asking, and that I think, I mean, as you just said, Anissa, people keep moving. Anissa just said that it's a small group, a group small enough that maybe we could all benefit from just jumping into each other. And I know that Erin, actually, you had a question, right, about something that we were just talking about. So yeah, thank you so much for letting us unmute ourselves.
Oh, absolutely. Yeah, the questions around, you know, not just menstruation, but perimenopause, menopause, you know, anti-estrogen treatments for cancers. Do we know anything about that?
No. We don't know much. So some people think that HRT would be good, but then you have to weigh breast cancer risk, you know? So there's just not enough known about this. And there's really not much money to go to research to fund it, to study it.
So to me, that seems like a lot of unanswered questions and a lot of weight for women to carry, knowing that they don't necessarily respond to medications maybe the way that's expected. They don't know how it impacts, you know, if they're taking treatments, if they're pregnant, the impacts it might have on, you know, perimenopause, menopausal things. And those are hard enough to deal with in and of themselves. Like if you've been through menopause yet or started perimenopausal symptoms, they're not fun. In addition to that, I'm just curious as to, you know, anybody that might be experiencing any of those things, are you seeing changes in how your medications are working or how you feel? Do you feel more fatigued? How it might be impacting women? And are your doctors asking these questions of you when you go in? And who is managing you? Is it your movement disorder specialist? Is it your gynecologist? Who helps navigate all of these issues?
Yeah, who do you talk to? It's a really good question. You know, having the background I do, I don't know who to talk to. My movement specialist, I can't expect him to know everything about hormones on top of the brain. My gynecologist, I can't expect her to know everything about the brain too. So who do I go to? So Rochelle, I see that you're on here. Do you have any insights into anything?
Sorry, I just had to go and let the dog out. What was the question?
Do you have any insights into anything? Of course you do, but specifically.
Yeah, no, like specifically which?
I think perimenopause and menopause.
Yeah, well, as you know, I have a lot to say about this topic. From, you know, premenopause to postmenopause. And, you know, as Kristi said, you know, the research we've done in terms of surveys has shown that, you know, 80% of women with Parkinson's report worsening of their symptoms across their menstrual cycle. About the survey we did, the original one, it was about 80% the week before the menstrual bleed and about 50% during the period. We know that basically what happens is when you the week before your menstrual bleed, your estrogen levels drop. And that has an impact on your dopamine. So we don't know whether it's on the receptors, the estrogen receptors, or the estrogen levels. And it's definitely happening. And the surveys that we did, both the Insight one, the Fox one, and the original one we did, showed that 90% of women reported that their neurologist didn't ask them anything about it, didn't, do anything about it. But we do know that anecdotally, some women are being treated by either getting extra levodopa during that time, or they're put on the oral contraceptive medication pill, for example, with no break. So they don't have a bleed, so that their estrogen doesn't drop, and that seems to improve their symptoms.
But it has to be both estrogen and progesterone, not just
yes,
progesterone.
Yeah, absolutely, right? Yeah. So so that's kind of on the menstrual side. So when someone asked a question, I think there in terms of the research around it. So we a number of us wrote a paper called The Unmet Needs of Women with Parkinson's, and raised a lot of issues that women, not just about their menstrual cycle, but other areas as well. And then in terms of the perimenopause and menopause, we also, in terms of surveys we've done, that women's report that their symptoms fluctuate a lot during that transition and sometimes get worse. And also there was a study by Bas Bloem out of Europe in Holland that showed that women's postmenopausal symptoms were much worse than their premenopausal symptoms of Parkinson's, which makes sense because basically you're losing all your estrogen, and estrogen is shown to be neuroprotective. So that's kind of, and in terms of research around medication, and in terms of HRT, there is some evidence to show that HRT might actually reduce your risk of developing Parkinson's. In terms of slowing progression, there isn't enough to say whether it does that or not. But in a recent survey we did, there was a number of women who reported that their symptoms got better with HRT. But if you think about it, a lot of the symptoms of menopause are very like Parkinson's. So it's a question of, it's the chicken and egg, but it doesn't really matter. Either way, women are feeling worse. So we need to be looking at solutions, and it doesn't have to be HRT. It can be other, non-medication treatments. But the reality is that we don't have enough research. And so a number of us are really advocating. And I suppose we as women need to be asking the questions, because only by asking it puts the neurologist on the spot to actually do something.
So HRT is going to be in the last, our third Fox Insight survey through the PD Avengers. So we're going to start working on that next week, right, Rochelle? We're meeting with them. So that's going to help fill in a lot of blanks, so that these surveys they can provide lots of preliminary data to researchers that would cost a lot of money for them to do these preliminary studies. We have it for them so that they can ask the questions, because we've already asked them for them. So we have the data. But 92% of women are not asked by their movement specialist about any stage of their hormones. 92% of women are not asked. And the same 90% of women will not ask about their hormones either, because they don't think that their doctors are knowledgeable enough, or they get ignored, or they just don't think they have time for it. Erin, would you want to?
I think Jennifer and Erin both had their hands up to speak. I don't know who had their hand up first, but how about we'll start with Jennifer.
Hi, I don't know if my video is working, but hopefully you can hear me okay. I love that we're talking about this, because I came across this amazing article in the New York Times. It's called "Women Have Been Misled About Menopause." And it talks about like this amazing study that had been done, and then why it was all of a sudden stopped, and how heartbreaking it is that, because it was like this big deal. It was like it was because women just are not studied. But anyways, I highly recommend reading this. And if anyone wants it, I can gift this article to them. Just email me. But after reading it, I decided to talk with my gynecologist and basically just experiment. So I'm trying like the lowest dose of estrogen. And I'm really intrigued by what you said, that it has to be estrogen and progesterone together. Why is that? Because I'm like, well, let me just start with the lowest dose of estrogen because I still menstruate. And so I'm like, I'm just going to experiment. And yes, my neurologist, my MDS is at Stanford. She's a female, she's amazing, but she never asked me about any of these questions. So I went to my gynecologist, and thankfully he's willing to kind of work with me to see if it helps my medication work in that 10-day window, which is where I struggle the most before my period. And yeah, so.
Yeah, it's really thought that it's the estrogen fluctuations. So by taking the pill with both estrogen and progesterone, it's going to keep that leveled out. So it's not thought the progesterone dipping is what causes the problem, but the estrogen.
I might just come in on the back of that, just that we're not too sure in terms of for definite whether it's just the estrogen or because the progesterone, they kind of feel that might have some role in it, but we're not too sure. But I suppose just to say in terms of HRTs, if you're specifically going on HRT, you have to have progesterone because of the risk of womb cancer. So that's the main reason in terms of if you're specifically going on a HRT, you shouldn't have it on its own from that point of view.
Awesome. And now I think Erin has her hand up. So Erin, can you unmute?
Yeah, thank you. I'm perimenopausal and certainly experience the increase of symptoms both when I'm menstruating and throughout the cycle when I can feel different fluctuations. And that was true before I started on Cinemed as well. So it wasn't just about a reduction in how the medication worked, but an increase in symptoms. But I also went through breast cancer treatment about 6 months after I was diagnosed with Parkinson's. And my oncologist was fantastic about recognizing that there may be an intersection, even though we didn't know what it was. And so he looked at things like, for example, if the chemo was causing more neuropathy and what that might mean for my quality of life with also having Parkinson's. But when it came time to do the tamoxifen, one of the anti-estrogen treatments, it impacted my Parkinson's so significantly that my quality of life really went down dramatically. And we saw that immediately with the use of the medication. And he was fantastic with saying, you know what, quality of life is what we're working on here. If you have no quality of life, what are we doing in terms of the cancer treatment? So he really supported stopping that. But it's a big decision, of course, for me in terms of recurrence risk, things like that. And he was open with talking about it, like I said, even though he didn't have the background. So that was really important for being able to get through the treatment. And I'd encourage people to do that. But also just to put it out there in terms of our anecdotal, while we are still getting the research together, that there were a lot of intersections in terms of how those two things came together.
That's amazing that your oncologist was willing to look into Parkinson's and to look up stuff and to ask you questions about it, because it's not the same for the rest of the experience of going to doctors in the US, you know, because there's no crosstalk between our doctors. It's just like you go to one and then I don't know if everyone else has the same experience, but it's like I go to one doctor and that's it. Like they don't talk to the next doctor. So it's like Becca, everyone's in a silo.
Absolutely. All right, Vam, am I saying that right?
Yes. Hi. Just to add to what Erin said, but not about what she had gone through, but something related to perimenopause, menopause. I've been having a lot of issues with, I thought I was on perimenopause with the age and what's happening, but then I had to go see a gynecologist because lately with cramps and everything else, with the ultrasound, it shows that there is fibroids, there is an endometrium thickening and all that. So I was just quite baffled because I think my tolerance is so high with Parkinson's and everything else around it. And it's so siloed that one doctor doesn't speak to another doctor. And I even have a very big experience related to just the movement itself. I had an ACL complete tear, and neither of them were talking to each other to decide whether I should go for the surgery or not, which is very imperative and very much related to the movement. having said that, the gynecologist, when I mentioned about Parkinson, he just did not pay attention whatsoever. It was all about, do I get an IUD? Do I go for a hysterectomy given the age and what to do about it? And no relationship to, so I'm just waiting. It's just a waiting game. And I just thought, I don't know if anybody else has experienced that, and if anybody has anything to add to that, or, you know, it would be greatly appreciated.
I don't know if anybody has any comments, Rochelle or.
Yeah, just sorry, Van, can you just say again, what exactly is your question in terms of?
So it's just an experience that I haven't seen a gyno for the longest time, and now that with Parkinson's I went to see, and he's talking about being on perimenopause and the excessive bleeding and the whole endometriosis and all that, and I'm not sure, you know, whether the hysterectomy, IUD versus, and if there's any connection to the, you know, the reaction to Parkinson's, or if the medications will have any interactions.
So have you had a hysterectomy, or you're considering having one?
I'm considering having a hysterectomy versus an IUD.
Yeah. I mean, I don't have direct experience. I mean, ironically, in terms of women who have an oophorectomy, have a higher risk of developing Parkinson's, and there's some evidence that might show hysterectomy in terms of a risk as well. But I don't know, when you have Parkinson's, I suppose again, it's going to affect your hormone levels, I would imagine, wouldn't it? So in terms of, I suppose it comes down to the pain you're having. And I you know, I don't know whether are you a member of any of the Facebook groups? There's a Facebook group called.
Yes, I am.
Yeah.
It was just more because this was a good topic this week today.
Yeah.
And it was more about, you know, I'm ready to handle the pain. I mean, with Parkinson patients, we can handle everything else around it. So, but my fear is, if anybody had experience about, you know, once you have one of those, what would that do to, if there's any direct correlation to Parkinson's, how you feel because of the hormone changes and all that, right? So that was really.
Yeah.
I don't think
you probably need to replace hormones.
Yeah, the IUD doesn't, I think, it helps with the pain or anything. It will just stop your menstruation or from like excessively bleeding. I don't think that it will help with any of the Parkinson's symptoms.
And Jennifer, you can unmute.
Thank you. I just wanted to say that, like, I think it's hard to be our own advocates. Like, I think that we know that we need to do it, but it's another thing when you're sitting in the office with a doctor and, you know, I always come in with like my list of questions and what do you do if you get shot down? But, you know, like I said, with my OB, with my gynecologist, like maybe I've gotten lucky, but I feel like there's a lot of winging it that we're doing because there isn't any solid information, and maybe what works for me isn't going to work for somebody else too. And I think that's kind of also another thing that gets so complicated with this disease.
I was going to say that we have to be our own advocates, but as you just said, Jennifer, it's very difficult. And sometimes we have different health insurances. We're in different countries. We have different experiences. And I joke with my MDS. She's a woman that we have to get along better than I get along with my husband, because our relationship is already longer than to last longer. So if you cannot tell them things like our menstruation issues or non-issues, then it's a problem. I think. I mean, I don't want to call it a problem, but it makes it difficult. Yeah.
And I don't know if anyone has ever asked their MDS. I asked my MDS, I said, do you have anybody else who's menstruating that you care, that you know, or that you know, is in your care? And she said one. She has one other patient. So I think it's also, they're limited too, you know, so like this is just, it's unfortunate, and it's so important that,
just like we're meeting, they can meet too. And there's a lot being done at the MDS level, MDS Movement Disorder Society. There are things, they have groups that didn't exist before, like focusing on women, focusing on holistic medicine. Of course, the one person that's involved in all of them is Dr. Subramanian, that you've probably seen her or even met her in person, because she's one of the few people who actually, what is it? Puts her money, no, puts her, what's the phrase in English? Puts her
money where your mouth is.
Thank you. Exactly. Anita to the rescue. Yeah, totally agree.
The only reason why I can say the information about the IUD, and it's totally anecdotal, it's because of another person who has Parkinson's, who's also a gynecologist, who was testing on herself to see what was going to work best. And so in her experience, it was the low dose pill that had estrogen. And the IUD didn't help.
I think going along with the self-advocacy piece, like I know for myself, I'm thinking about the way I've been socialized as a woman, I think, is to sort of take it on myself and try and solve it myself and not be a burden or not be difficult or all those kinds of messages. And for example, I started having back pain a couple of years ago, and I was like, oh, well, I guess this is just a new symptom of Parkinson's I'm going to have to put up with, sort of. Oh, well. And so finally it started waking me up at night. And I finally was like, I think I'm going to call the doctor. And it turned out it was shingles that I had. And, things like that, where I'm just sort of like, better just suck it up kind of attitude. I don't know if anybody else has that experience, but.
It almost sounds like there's so many unanswered questions that it's often you do suck it up because you just attribute it to maybe just another part of Parkinson's when it may have nothing to do with it. So Kristi, another topic that we'd like to kind of dive into a little bit is the topic of self-image. There's such an image conscious society we live in. There's so much pressure to be perfect all the time. So can we talk a little bit about, and I know you did the article on self-image in women with Parkinson's disease, and you highlighted some of the things that impact self-image. Can you talk a little bit about that?
Yeah, so slowness, tremor, and rigidity were the main motor symptoms that really impact self-image. And the non-motor symptoms are speech issues and urinary issues, which totally makes sense when you think about it, because when you have urinary issues, you're going to, of course, feel self-conscious, and speech issues too. It absolutely makes sense of why that would be an issue. I don't understand why more people don't understand that of course it's going to be an issue. But because of that self-image issue, about 66% of women are also, they stay away from social situations. So it impacts their social life, which then impacts their risk of depression. So women are 1.3 times more likely to be depressed than men, which links back to less socialization and more self-image issues. So they affect women much more than they affect men.
Well, and I'm curious, even from a depression or even an isolation standpoint, like it can impact all areas. When you're young, you could be working and you have an image that you want to display in the work environment. If you're married, feeling desirable, sexy, with your spouse, your partner, or if you're dating, trying to get out there and meet people and feel good about yourself. I would love to kind of explore that a little bit, because that's, we feel that anyway, just as women, but to have that added frustration of, the symptoms that can further complicate that's a significant barrier, I would think.
And so slowness, tremor, rigidity, it doesn't change based on hormonal status. So it's the same for whether you're premenopausal, postmenopausal, or perimenopausal. It's all the same. They're all the same levels for what affects self-image the most.
So I'm curious if anyone has had that struggle. I mean, I know it's a sensitive topic, but I feel like that's something that we don't necessarily talk about. I mean, women needs in general aren't really being addressed very well. And that whole self-image concept, I think it affects anybody. with Parkinson's at any age, like you were saying, but to be young female, we have, like I said, there's this idea of what we should look like, the social media, pose of beauty, and that's not always what we feel about ourselves. Rochelle, go ahead.
I was just going to say it's. I mean, I don't so much because I don't have a tremor. I don't have, sort of some of the symptoms that might affect in terms of that self-image. But I do think there's, the whole stigma. I do think there is sort of an almost internal issue around, that you are for a lot of women that are trying to, work, be a mom, be the captain of your ship, that can be a struggle when that sort of, ability is impacted in terms of trying to do it all, as a lot of women do. So I think that's a kind of an issue as well. And I think in terms of stigma is, I was talking to a number of women recently who, are hiding their Parkinson's because, they don't, there's a fear of losing their job, of, being moved off their job, etc. So I think there's sort of those issues as well, as the kind of self-image.
And Jennifer, you have your hand raised.
I've done a couple of videos on this, like, because basically Parkinson's is just not sexy. I mean, like I've actually like been crawling to the bathroom and I've tried to like imagine like, how could I make this sexy? I mean, like I've actually had those thoughts before, but like, I really feel like one of, for me at least, the most, because I still bartend. So like, I've been dyskinetic behind the bar. I've had slow movement behind the bar where I can like barely reach for, the tap handle. I mean, like I've had every kind of symptom behind the bar. And I feel like at least for me, the magic has been acceptance, because the reality is it's like, we're not going to feel sexy every day, no matter how we look. Like, I feel like there's just like a natural fluctuation in self-confidence anyways. And so like, if we understand that, but then we also just accept I call it our Parkinson's body. I feel like people who are at peace with who they are kind of there's something magnetic about them. And it's difficult to get to that place of acceptance. I understand that, but I feel like acceptance is the beginning of kind of how we can feel sexy with a disease that isn't always going to make us feel that way. So, and if I can just say, like, I've got the smallest bladder on the planet. Like, if I'm, getting frisky with the husband, I mean, sometimes like I'll have to sneak away like 5 times before I feel like, okay, I can continue. And it's just like, he has to be okay with it. And if they're not, that's, you know what I mean? Like, I feel like, yeah, I haven't had a problem communicating it, like I feel like most men, at least from my experience, they've been like, okay, because I was single actually when I was diagnosed. They understand. That's been my experience. I feel like if we overhype it too as well, and worry about it too much, it might not benefit us.
Thank you for sharing that. Yeah, someone wants to come and hang out at your bar, Jennifer. Marlo, you have your hand raised.
Yeah, I just wanted to, along with Jennifer, I too get it out there. I tell whoever will listen that I have Parkinson's disease, because I just think that it's easier to, I don't know, I guess it's easier to make excuses for yourself. But my question to all of you is it inevitable that this whole urine incontinence thing is going to happen? Because that's one thing that I dread. I mean, I could probably deal with everything else except that. And that bothers me.
Not everybody's going to have every symptom. And people that do have urine incontinence, you can actually go see a pelvic floor specialist.
Mhm.
I personally couldn't afford it because it would be $50 copay for my my specialist copay times 10 times. So it was like way too expensive. But I have the small, like Jennifer, I have the smallest bladder in the world too. So
Okay.
I just come to accept it. But
could it be fixable? It is fixable?
Yeah. you can go to a pelvic floor specialist and get exercises to work on it.
Okay, thank you.
I met a 21-year-old young onset
Wow.
Parkinson a week ago and at an event. And it just, this conversation makes me think of her young, 21, like she's just getting started. She's dating, you know, she's, you know, has all of the things that my 18, 19-year-old daughter have at that age of self-image. And, you know, now she's navigating that with Parkinson's, and she's had symptoms for a few years. So she was actually a little more symptomatic than, you know, might see in some of the other younger onset. So, I mean, I think this is an important conversation. It doesn't matter what age you are, but it definitely is very impactful when, you know, you don't necessarily feel good about yourself, maybe in general, maybe you're somebody that struggles with self-esteem, but then if you have issues with your body's movements, or like you said, the urinary incontinence, it can be very frustrating. So I'm so glad that you guys are sharing this. Esther, I didn't know you had your hand up, but if you want to unmute, please share.
Hey, everybody. So I just want to speak to, I don't really have a question, I just have a comment. Since I got diagnosed with Parkinson's in February, like I could give two flying figs what anybody thinks about me. So I don't have, like, I've lost all like filters and caring of anything like that. What I struggle with is the inability to do the things that I like to do in regards to my personal appearance and my self-care, that I just struggle with. So like, for example, you know, I can wash my hair. If I'm like peak med, I can maybe blow it out, but I'm not gonna be able to straighten it. Or if I straighten it, I'm gonna burn myself like 6 times. And if I can get my hair done and not burn myself, I can get my makeup on, but I'm gonna have like one eyeliner like here and one eyeliner over there. Like I can't like put it all together. And I know it's like a superficial thing, but for me, it's tied to my own self-esteem. And it's something that makes me feel better about myself. And if I don't do it, then I just feel worse, you know?
Esther, this
And
is the first thing I've been able to put on mascara without like looking like a raccoon on my left side. So I keep on poking myself in the eye almost.
Sometimes,
And
Esther,
like,
if I take a deep breath before I put my mascara on and my eyeliner, if I take a nice deep inhalation and then let it out, I could get it on quickly.
I mean, I can't do, like, forget about the fake eyelashes. I can't do those anymore. I'm supposed to go to a Christmas party on Friday. I don't know. I haven't worn heels in like 6 months. Like, am I gonna,
Yes,
you know,
right.
like, can I still dance in heels? I don't know. Like, and I think there's, for me at least, I feel like societally, there's this perception that like this is something that we do because we have low self-esteem and we want men to feel attracted to us. And for me, it's like, it's not about that. Like, this is a me thing. And I mean, I was talking to my friend Amber, she and I did a podcast recently and we were talking about that, and she was suggesting like the stamps, like the eyeliner stamps, and I did them backwards. And it still didn't work. And I was just like, there has to be like better ways, like better tips of things that work for people to at least buy me some time, you know, till I just, you know, have, I don't know, I've got like a 90-year-old mom who's still like perming her hair. So I don't think this is something I'm going to grow out of, you know, but I just think it's something that we don't talk about enough, because depression is hard enough to, as it is. And these kind of things, like, I mean, I guess my question is, at some point, am I just not going to care anymore and like, just let it go? Like, can I get a timeline on that? Or are there, you know, reasonable expectations for me to be able to maintain some sense of like who I am, you know, physically for the next 5 years or 8 years or 10 years, you know?
My timeline on heels was like native Parkinson's. Like I just
But that-
never liked heels. I
And
like
our friend does wear high heels. Our friend Sanlene.
Oh yeah,
I mean,
I
I'm
had
5'8". I'm 5'8", and I would like to be a solid 4 inches taller than every man in a room, like at all times when I leave the house. Like I'm just bossy like that.
I'm 5'2". I'm just
So
used to being short, so I just wear
For
glasses
makeup,
even shorter.
sorry, for makeup though, there is makeup already that for eyes makeup. That I can't remember her name now, but she has Parkinson's and she has her own brand. It's Guide Beauty, and I mean,
Yeah.
yeah. So you can get.
can you
I mean,
put it in the chat?
yeah. I find exactly the address. I'm not going to run and get it, but yeah, she designed the tool in a way that you can put your mascara and you can do. I could never do eyeliner before, and I cannot do it still now. But if you could do it before, then you'll be able to. I'll get you this exact address because we interviewed her. We used to be in a women's group in Spain, and we interviewed her. And it was really, really cool to be listening. And now, what's her name? This actress, the actress that has MS.
Oh,
Yeah.
I know what you're talking about, and she has really
Yeah, so
cool
she's also part of.
products.
Yeah, she's yeah.
Thank you,
I'll get you
Rochelle.
that
Okay,
address
so
right
it's
away.
Guide Beauty. Okay,
Yeah.
I appreciate that. Yeah, and then somebody said tattoo eyeliner. See, that's the thing though. If I just don't know if I can, like, I have tattoos, but the pain triggers my symptoms so bad, and then having to be still, I think, like, I don't know, like the pressure of being still makes me tremor and move more. So I just have this nightmare of me then just like having face tattoos or something.
So I had to go for a wedding just a couple of weeks ago in England, and I just got myself done at a makeup place and got my hair done, and then wore a light heels, and I went to the dance floor and I danced a little. So it's just to give a small
A small victory. I
yeah,
love
small,
it.
Yeah,
So
I totally wear
bit,
heels.
yeah, I was a bit worried about being on the dance floor because if I fall, and most of them were totally tipsy, and I was totally under the influence, and I was going to be one of those, but I don't drink. So I was like, oh my God. And then I managed to not fall on the floor.
Yeah, I mean, I agree. I still wear my heels. I don't wear them every day, but when I go out, I still like to wear them. But I notice I can't quite jump up on the dance floor like I used to on my heels. But I kind of refuse to give in and not wear a nice pair of heels. I may not be able to walk very far, but I still like to wear them now and then. But I don't think in terms of my own, I think I agree with you, Esther, in terms of it's a very personal choice, but I intend to be myself as long as I live with Parkinson's. I'm not going to give in terms of so I don't think there is a timeline on it. I think the only timeline is personally is going to be in my head. That's my own view on it. I don't know.
Jennifer, go ahead.
I was just gonna say, kind of like with the crawling to the bathroom, like how can I make this sexy? Or is it sexy? Like I feel like it's just like this idealist in me. Like, so I'm 10 years in, and I feel like I'm always like, if something's not working, I'm gonna figure out a way to make it work. So maybe it might take me 20 minutes more or 30 minutes more to do my mascara, then that's okay. I'm gonna make that adjustment. But like I just have this like image of, like, I love doing the little like eyeliner extension, kind of like Amy Winehouse, not like that severe, but I love doing that. But I'm like, maybe someday if it starts getting really crazy, I'm like, okay, maybe I could be like a version of David Bowie or something, like I could do like something fun with it. I mean, I don't know. I feel like the one thing about this disease that's really interesting is I feel like it forces you in a lot of ways to kind of think about things that, we don't really want to think about, like, God, can I wear heels anymore? Or like, am I going to have to wear a diaper? Like that's, and she's right about the pelvic floor thing. Like there's exercises you can do, but yeah, it's scary. But like, and I try not to look too far ahead. I don't know if anyone else is like this, but I try not, like, it's important to plan ahead, but I feel like I get too doom and gloomy if I look too far ahead. Like I really try to stay focused on the next 3 months. You know, I feel like it's more manageable, and I feel like I'm more at peace, and it's not so scary when I'm like in the now versus like what the hell is going to happen to me down the road.
That's funny. I was having breakfast with one of my friends who she just like, and we were talking about that this morning, how she just likes to think of everything as one day at a time, because it's less overwhelming than thinking too far in advance.
Now that might suck also, let's be honest. No, because maybe you want to plan ahead because you want to, I don't know, get married if you're single, or make that trip that you've been saving for a long time. So that it's hard to strike a balance, and it's always very important, as we all know, and to take care of mental health and find support, professional support in the sense of, you know, psychologists or therapists or whatever you want to call it, and then the support that we get in groups like this, you know, or like the groups that we've been mentioning. I was mentioning Dr. Leaders, that a bunch of you have been in her meetings before. It's really good because it's for women only. So we, you know, we can talk about menstruation as much as we can, as we want, without men looking at us like, oh, here they come again to talk about their stuff. So yeah.
Awesome. Michelle.
Anissa, we just stole the show from you. I mean,
no, that's fine. I love this. This is exactly what it should be. So please, Michelle, go ahead.
I just wanted to say about the urinary incontinence. So I suffer from that, and I wear pads because I have gone through every physiotherapy, internal physiotherapy, pelvic floor, you name it. But part of it is because I had 2 kids, so that obviously is one thing. But definitely, I think the Parkinson's exacerbates the kind of urgency. But besides the pelvic floor, there is a medication called, I think it's Microbon. Anyway, there is a medication that is very effective for urinary incontinence if anyone does suffer from it. And also to be mindful that there are a number of urinary meds that are prescribed that actually are associated with the risk of dementia. So you have to be really careful about what ones you get prescribed. So
I was taking oxybutynin, and it was linked to. I was taking oxybutynin for a while, and it was linked to a risk of dementia. But reading the actual primary literature, it was pretty shady data. So I would recommend that you have someone read the primary literature too, to go through it to make sure that it's really associated with it.
Yeah, I think there's sort of different ones.
Right.
And then the other thing was just in terms of Baram asked about the IUD. So recently did a survey of women with postmenopause or menopause, and I just checked the results there. And women who, it seemed to be kind of like mixed results. Women who had used IUDs, some said that it improved their symptoms, and some said their symptoms still got worse. So I suppose just again going back to the point that it's very individual, and we need more research. So I just wanted to.
I participated in one of that surveys when you did it, Rochelle.
Oh yeah. Great, thank you.
Thank you. Yeah, I wasn't one of those at that time. It was just a perimenopausal timing, but
yes.
Yeah, but in terms of incontinence as well, I have that. I tried everything, doesn't help. I was going to do a laser, because there's a laser that the research is going around that you can do a laser treatment for stress incontinence. If anybody's looking into that.
Well, I'm actually going for surgery next April. I've decided I'm just getting the prolapse.
Yeah.
That's the reason I'm going. Yeah.
But that's what I was fully recommended. I kept postponing it with hoping for other things to do, and then now, of course, with Parkinson's, the urgency is also there. But you know, especially right now with the weather changes and the sickness, cold, sinus, you know, coughs, incontinence is your best friend right now.
Yeah, it's very annoying.
Yep.
Well, this has been such a great conversation. I don't know if you have anything that you want to close us out with, Kristi?
So if everyone hasn't downloaded, oh yeah, so make sure that you get Rochelle's app, My Moves Matter. You can get it at you can look it up at mymovesmatter.com. It's also available in the Apple App Store and in the Google App Store. Also, Pregnancies Spark is if you know anyone who's pregnant with Parkinson's, that you should go onto that to register to the registry to log your pregnancy. Also, In Her Shoes at www.yopdwomen.com is going to have, you can download In Her Shoes for free on there, which is the book that we wrote, a booklet that we wrote for young women with YOPD, by young women with YOPD, what we wish that we were told when we were diagnosed. So,
awesome.
And it's available in 5 languages. So English,
incredible.
Spanish, Dutch, German, and what else? I can't remember. Sorry.
That's all right.
Oh,
So we
Portuguese.
have a
Sorry.
lot of, what is it?
Portuguese.
Portuguese. Awesome. So we've dropped a lot of resources in the chat. So Kelly put in there some instructions to save your chats. There's 3 little dots in your chat box, and it'll allow you to save that to your device. So you can go back and read some of these articles and websites and all of that information. So thanks for all of those resources. Thanks for the conversation, for everyone joining in and, you know, making it a good conversation, a good topic. So I want to thank Kristi so much for joining us and leading this. I appreciate all of you contributing, Isabella and Rochelle and Marla, all of you. So thank you. And
make sure everyone downloads Rochelle's app because it's really useful. It's your way to track your own data. So you have something to bring into your movement specialist when you go and you're saying that you have some issues, that you're having problems, that you notice that your meds aren't working right with your period. You have the actual data to show them that it really is happening. So that's so important to be your best advocate.
absolutely.
Thanks, Kristi. And if I could just say, we're hoping to do some research with women using the app to actually prove what we know is happening. We're hoping to do prospective studies. So yeah, because, you know, if they won't do the research for us, we have to do it for ourselves.
Right. We need to bring it to them. So,
Well, thanks everyone.
Thanks so much,
Wave to
everybody.
each other from wherever you're all joining in. Thanks so much.
Thank you.